Well, in terms of mouth guards that we can make for patients, the traditional one, the patient comes in, they've been grinding their teeth, they're wearing their teeth down. Usually they're aware of it, or they'll wake up in the morning and they're clenching their teeth. Usually those people are aware of it, or if there's a lot aware, we'll point it out and show them to make them aware. So we can make just a clear plastic guard that fits over the teeth to wear at night. It's not actually going to stop them from grinding. To some degree, some people say it does, some people say it doesn't, but it's definitely going to protect their teeth. It's definitely going to protect this joint in their mouth. And oftentimes it's going to, if the type of patient that gets a lot of headaches, and that's usually women more than men, but some men, but mostly women, or even students. When we're really stressed out around finals and such. These guards will help reduce headaches too, which is really nice. And the one we make the most, well, there's two we make. One's totally hard, one's hard, has a soft lining on the inside, so it's much more comfortable. Those are two of the guards that we'll make most of the time for people that grind their teeth. Technical term is bruxism, but I think people have heard that enough. It's almost becoming not technical. And then people that have trouble with the joint, it's called TMJ. So that's a pretty common term now. In addition to all this grinding they're doing, these people have difficulty opening their mouth at times. They have trouble eating. The jaws get tired easily. They'll have a lot of headaches, neck aches, earaches. Now there we'll make, the appliances look similar, but they're not. We'll make something for the daytime, we'll make something for the nighttime, we'll reposition their jaw in different places. So the therapy is quite a bit different. If you look at the appliances, sometimes they look the same, but they're not. They're designed differently.